Hey guys, we're coming to you from Mary Free Bed. We're going to give a quick introduction to ourselves. We're going to show you an awesome video about our hospital, about our rehab residency, and then do a PowerPoint and do Q&A.
I'm JP Ryzik, I'm a PGY2.
I'm Lola Abdullah, PGY3.
Beth Aguila, PGY4.
Kyle Josephson, PGY4.
Dick Ball, Program Director for the Residency.
Mike Jakubowski, PGY, about 44. I'm the CMO.
During my interview here, I was just blown away, to be honest. You know, the history is pretty remarkable.
This is an amazing place to see pathology, to see patients, and to learn from patients.
Knowing that every member of my team is giving as much effort as I am and cares as much as I do matters, and it goes a long way.
You can tell that patients come first. Not only are the people friendly, but the place is inviting. And I think that combination really allows us to do our job in a way that we can't do at other places.
We do move quickly and we can make decisions, and we don't need to go to 3 layers of board or get approval at X, Y, or Z committees. Decision gets made and we jump into it with both feet.
A few years ago, I got a call from Dr. Michael Jakubowski, who is our Chief Medical Officer, inquiring as to whether I might be interested in joining the Mary Free Bed family.
He is as intensively interested in rehabilitation and this residency and in teaching as anyone I've ever seen.
We are now a young mobile program with everything in place, and I think our main goal at this point in time is to become one of the premier residency programs in the country.
It's really invigorating to have the residents here leading part of the charge.
Over the last few years, we have obtained permanent accreditation for both the residency program and the sponsoring institution, Mary Free Bed, from the ACGME, and that was kind of our last hurdle to becoming a fully qualified residency program. We just graduated our first class of residents, all of whom who went on to good positions, so we're also quite happy with that. There's really nothing we don't have here. I would say the raw materials are here to do a superb job, and I intend to capitalize on those.
You know, we have this big, beautiful hospital, and the big, beautiful hospital on every floor has 3 gyms.
We have a spectacular physical plant here with 119 beds and probably one of the most varied clinical experiences on the inpatient side that you're going to find at any institution in the country. We have extensive therapy, speech and language therapy, recreational therapy. And
everybody eats, sleeps, rehab. It's the only thing we think about all day long.
So with that, I'll say welcome to Mary Free Bed.
There are a lot of factors for where you're going to choose to go and what you're going to choose to rank first.
The first thing that drew me to Mary Free Bed is just the people. Everyone here is so friendly, so courteous.
And after being here, why would I do a residency anywhere else? It has everything you could want in a residency program under one roof.
The scope of rehab that you really see everything from brain injury, spinal cord injury, pediatrics.
Stroke to amputee. The opportunities to learn on the floor are tremendous.
You just walk down the hall and you feel uplifted by just the building itself, and so that is a huge plus.
Our residency room is beautiful, renovated last year, state of the art. It fits all 12 of us beautifully. We have our own conference room in there, and our call room is a hotel room. It offers everything you could want in a residency program. I think that's the type of environment that learning is best in.
it is also an amazing place where if you're interested in and there are amazing research institutions within Mary Free Bed, but also within the city of Grand Rapids.
We're bumping shoulders with other residents at neighboring institutions and swapping stories. And I think that level of collaboration is important.
There are so many examples of innovation that's happening here.
Being able to kind of tailor your passions and your lifestyle within a residency program, Mary Free Bed is able to do that.
And West Michigan has a uniqueness about it in the sense that, you know, people are friendly, people say hi to each other.
It's a big little city is what it is. So it provides you everything a Chicago or a New York really has to offer, except just in a smaller, more convenient package.
I could not be here without going to one of the many beautiful beaches.
We get to see major sporting events here. We get big name artists who come through here.
And the great thing is you can get anywhere in 10 minutes. You don't have to sit in 4 hours of traffic. You don't have to take public transportation. Everybody can drive, and the cost of living is great. What really matters when you're picking a residency is the feel of the place and the people. And do you feel that you will get a good education, that you will be a competent physician, that you'll be able to do whatever you want to do when you're done, and on the side of that, have fun doing it.
Someone once told me that the friendships you build during residency are going to be unlike any friendship that you have in your life, because you have gone through an incredible experience, a challenging experience, and in the end, those relationships that are forged in a sense can never be broken.
We all have each other's backs. All of us are pretty much, when you're on call, everybody else is available to talk to if it's about their patients, right? That's not this separation. It's not this fear. Everybody's open to questions. Everybody's willing to help. Everybody's willing to stay late, which is great.
Some days are harder for some residents than others, and so we're always, we realize that and we try to help each other out.
It's humbling to be a part of this, where I honestly feel that there are no limitations. If you can think of a great idea and you can put it together in an IRB or in a proposal, that support is there.
As a resident, sometimes there's a little too much hand-holding, and you don't get the autonomy to make your own decisions for the patient, when in 3 years we're going to be leaders in our field and out into the real world practicing medicine. So you do need some of that autonomy, and that is offered here. Mary Free Bed being so big and having so many resources and so many teaching faculty, it allows a lot of one-on-one time with your attendings and with nurses and PTs and orthotics or whoever you're working with, and that trust eventually turns into autonomy and the ability to seek out answers and do things in any direction that you'd like to do that's obviously safe and efficacious.
That opportunity from a resident's perspective is it positions us not only to have good patient experiences or patient interactions because of the facilities, because of the people, but it makes our jobs more fun on a day-to-day basis.
So we hope you guys enjoyed that video about our hospital and our PM&R program. So let's talk a little bit more about the program. So first off, what is Mary Free Bed? What is the name? So it started in 1891. There was a group of women. Mary was the most common name at the time. And so they held a fundraiser of people, anyone named Mary. They asked them to give money. And so they had enough money to create their own first free bed. And initially it was pediatric rehab. And so that's why we're called Mary Free Bed.
Yeah, here at Mary Free Bed, it's really a one-stop shop. So patients can come and get comprehensive inpatient rehabilitation care with all the different disciplines in PM&R, as well as outpatient, where they can get a variety of procedures. Orthotics and prosthetics department right on site. We have our therapy gym. We have a gait lab with 0G. We have 2 beautiful therapy pools. So really, patients can come here and really feel that they have a rehabilitation home.
A lot of our inpatient rotations are broken up by discipline, and we have these different specialty programs within our program, within the hospital here. We have amputation with one of our faculty who's been doing amputee care for many years, and so we get opportunities both inpatient and outpatient, and then get to follow up with the orthotics and prosthetics folks downstairs. We have brain injury, cancer rehab. We also have an intensive medical rehab unit where we have 11 beds that have the ability to care for patients who are trained on ventilators. So we're doing therapy with patients on ventilators. We have 12 pediatric rehabilitation beds, and then we care for multiple different diagnoses. And I think that's one of the strengths of our program is the diverse pathology that we get to see here, and with the multiple different diagnoses as well.
PGY2 year, it's pretty inpatient heavy. I mean, you can see the numbers there. They work you too. You're on call. We split up the days Monday through Thursday. 4 residents. Each resident takes 1 day. So I'm on call every single Tuesday, and then roughly every 5th weekend, something like that. And it is tough. You're covering the whole hospital overnight for every single call, anything that the nurses need. But I feel it's a really good experience because those are going to be what you're doing for the rest of your life. It's the right amount of call, but you also have the support that you need, and you don't really get burnt out doing it. The other bonus is that I did get a nice little salary bump coming into this year.
Yeah, PGY 3-year, it's really a mix of inpatient as well as outpatient. You really start to get involved in a lot of electives as well. We start to continue to do a lot of procedures that maybe we were exposed to our PGY 2-year, including a lot more EMGs. We have a lot of experience with that. We have great ultrasound curriculum. So yeah, it's really kind of a mix of both inpatient, outpatient procedures.
And then our 4th year is more of outpatient heavy, but there's still an option for inpatient electives. We have a lot of electives within the Mary Free Bed network, and then also kind of at neighboring hospitals, Spectrum, St. Mary's. I know myself, I'm kind of interested in neuro rehab, so I get to do neuromuscular. We get to do radiology. Basically, we have great connections with people in the area, so you can, if you want to make an elective happen, you can do it here. We have the support. And we have a reduced call schedule, but of course, you're more the seniors, so now you're kind of helping out the 2s and the 3s. That's part of our role.
Here's a list of the elective opportunities that we have. As Beth mentioned, these are done during your 3rd and 4th year. Depending on your interests, we're able to curtail specific electives to meet your needs. We have opportunities with neurosurgery, orthopedic surgery, again at neighboring institutions. We also have focused electives here in-house as well, such as pediatric, outpatient, along with some extra neuromuscular work as well. One of the things we can do as an elective is also research. We have a research department here with a lot of ongoing research projects, both just institutionally and then also with other neighboring institutions, both locally and nationally as well. We also have a subacute rehabilitation floor on our 5th floor. So our 3rd and 4th floor are all inpatient rehab. 5th floor is subacute, and so we can do a subacute rehab rotation to understand a little bit about the continuum of care, which I think is important. We get sports medicine exposure, both as a required rotation and also as an elective as well. So if that's an interest of yours, you can do more time there. And then wound care is also an elective opportunity as well.
You have 5 minutes remaining.
And as far as didactics, we have them weekly. It's changed a lot really since when I was a med student looking at Mary Free Bed to right now. Every Tuesday, Thursday, we'll have an hour of lecture in the morning, and then Wednesday in the afternoon, we'll have a couple hours. Most of the time, they're led by department faculty, experts in their fields, physicians with some kind of fellowship. Grand rounds are every Monday. And then we also have a musculoskeletal ultrasound lecture series, kind of with a very well-renowned expert in the field.
So our core curriculum you'll basically review all the topics you need to know for boards 3 times over the course of residency. And one of our strengths is our anatomy block. We get to go to MSU and utilize their perception lab.
So here at Mary Free Bed, residents are really valued, including resident wellness, as you can see with our very generous benefits package.
So we'll kind of just open it up to questions.
Let's see. Thanks so much for your time. It sounds like there are great research opportunities available. Can you elaborate on some of the research projects that residents are currently involved in?
Yeah.
Absolutely. There's a variety of, actually, most of our residents are actually involved in research projects. There are research collaborations both locally with the Van Andel Institute, as well as nationally, as was mentioned, with the Mayo Clinic, looking at a variety of different, potential treatment options for arthritis. There are research projects looking at spinal cord injury patients and innovative technology as far as that is concerned. Really, there's really a variety of research projects and really the support there for, if you have a research idea, you can really kind of make it happen. And that's really one of the amazing things about this place is just that energy of support that's really here, both at this institute and really that there is no limit. The walls of this institute, kind of just with the relationships that we have, really there are no limits as far as that is concerned.
Next question is, do most of your grads do fellowship? And if so, what are common ones?
That's a good question. We graduated our first class this past year, so we only have one graduating class. One of our residents went on to do a fellowship in interventional spine in Flint through Michigan State. And then our other 3 graduates, one is staying here on faculty, one went to Washington, the other one went to run a rehab hospital in North Dakota. So. Next one is community outreach opportunities. What are they, or what kind of examples? You want to speak to the adaptive sports?
Yeah, so our adaptive sports kind of program is really strong. They have, there's this own little kind of facility downstairs. They have all kinds of different adaptive chairs for different sports. They can do adaptive rugby, hockey, soccer, basketball, and just as an extra shout out, if anyone's interested in coaching some very cute 8-year-olds on the adaptive basketball team, they're looking for a coach. But you're welcome to go out, be as active as you can with it, show up, participate, get in the chair and actually see what it's like to play the sports. I know just yesterday, they had adaptive yoga just right outside here at Mary Free Bed. And they're just kind of weekly events going on.
And the last question is about board prep. The program provides for making sure that we're prepared for boards.
Yeah, so the program has this great resource of, there's a lot of kind of board review preps. The last class, they were able to use the 1 week from Washington, and that's free for residents. So that entire week is paid for by the residency program. So we get that benefit. We do board prep all throughout the year, so it's heavily involved in our curriculum. So almost the board prep is like a bonus. So we feel that I feel like I'll be ready for boards.
Sorry, we're out of time. If you guys want to leave an email that students can contact you at, that would be great. Thank you so much for your time and your great presentation. Next, we'll be moving on to Schwab Rehab. Thank you so much, guys.
Thanks. Thank you.
Thank you.